In this episode, we're talking about infertility symptoms that you do not want to ignore and how to take action now so you can finally get pregnant. Welcome to the Finally Get Pregnant Naturally podcast, the podcast helping women identify the real reasons you haven't conceived or stayed pregnant so you and your partner can finally grow the family of your dreams. I'm your host, Dr. Katie Wood. Let's dive in, shall we? In this episode, you're going to learn the most common symptoms that are signaling that something may be interfering with your fertility, why these symptoms are often brushed off or dismissed in conventional care, and the first steps you can take to uncover the root cause and move toward conception with confidence. If your body has been nudging you and whispering different symptoms, whether they're subtle or seemingly mild, you don't want to wait until your body is full-blown screaming at you, okay? These are signs of potential fertility issues that you should not ignore and what you can start doing about them right now. Let's talk about 7 potential signs that something is going on with your fertility. So, number 1, if you're experiencing irregular or absent periods. So, whether you're trying to get pregnant or not, if you are a woman in your reproductive years, your cycle is your monthly report card. It is an overall indicator of your health and vitality. And if it's irregular, if it's short, long, or missing altogether, then that could be a sign that ovulation is not happening either consistently or it's a weak or suboptimal ovulation. And without ovulation, conception is not possible. This could point to many different things like PCOS, thyroid issues, or other hormone imbalances. Number 2 is having very painful or heavy periods. So, period pain that interferes with your daily life is not normal. So, this can be a sign of endometriosis, fibroids, or inflammation within your reproductive organs, all of which can affect fertility. Number 3, and this is a very common one, is spotting before your period. So, having consistent spotting before your period can suggest that you're having low progesterone levels, a luteal phase defect, or an issue with uterine lining receptivity. And progesterone is absolutely essential to maintaining a healthy pregnancy. Number 4 is recurrent miscarriage. So, having more than one miscarriage is a red flag. I don't care what your doctor says, if they tell you come back after you've had 3 or 4 miscarriages, having even 1 or 2 is a red flag. And it can be tied to immune issues, clotting disorders, hormonal imbalances, nutrient deficiencies, vaginal microbiome dysbiosis, potential sperm issues, or DNA fragmentation on the male side, and it deserves a deeper investigation. Okay, you should not have to go through a loss after loss in order to get answers. Number 5 is any signs of hormonal imbalance. So this could look like acne, hair loss, unwanted hair growth, severe PMS, mood swings, low libido is another big and common one. These can all signal underlying hormone disruption that can overall have an impact on your egg quality and your ovulation. Number 6 is chronic fatigue or brain fog. So exhaustion isn't just a result of being busy. It can actually signal thyroid dysfunction, adrenal dysregulation, or nutrient deficiencies that can impact fertility. Or maybe there are other things going on in your life, like a lot of stress, poor nutrition, or lifestyle habits as well. Number 7 is digestive issues. So this could include bloating, constipation, diarrhea, or IBS-like symptoms that can point to gut dysbiosis or food sensitivities. And since our gut regulates so many different things in our body, like hormones, detoxification, immune function, thyroid health, this can directly affect your downstream reproductive hormones. So why do these symptoms get brushed off in conventional care with your regular PCP or maybe your fertility doctor? And one of the honestly, the biggest frustrations that I hear from women is that their symptoms are minimized or dismissed. They're told that their painful periods are normal. Spotting isn't an issue in terms of being able to conceive. Fatigue and brain fog are just chalked up to maybe extra stress, poor sleep. And if you've had a miscarriage, maybe you were told to just try again and again to come back after you've experienced typically more than two is what I hear from women. And this happens because conventional care is laser focused on treating the disease and not identifying the underlying dysfunction within the body. So if you don't meet a certain criteria for something like PCOS or endometriosis, oftentimes you're just set on your way. Maybe you're diagnosed with unexplained infertility, and that can be really frustrating. And a lot of times, doctors are just looking at basic surface level labs. So they're looking at just your TSH for thyroid, not a full thyroid panel. Or they're just looking at cycle day 3 FSH, or maybe even just your A1C or fasting glucose, but they're not looking at your fasting insulin. So by looking at only these basic surface level labs, they could be missing the full picture here. Often symptoms that can interfere with fertility can overlap everyday life, like fatigue, digestive issues, mood swings, and these are often normalized instead of investigated further. But I want you to anchor this in. Your symptoms are data. It is your body's way of communicating with you and telling you that something deeper is going on. So ignoring these signs and symptoms is not going to make the problem disappear. It's what's going to delay your ability to heal and conceive and also potentially make the issue even worse. I had a recent client that I was speaking with, and she was kind of subclinical hypothyroidism, and years went by and now it is Hashimoto's. So when things are not being addressed, they can progress into something that can cause even more issues, especially for fertility. So what are some things that you can do now if you're experiencing any of these symptoms? Track your cycle. This is so important. And I don't just mean using an app or using LH strips or OPKs. I want you to keep a detailed record of your symptoms, your cycle length, and ovulation signs. You can use BBT where you're tracking your basal body temperature, or at-home hormone trackers like Mira or Anito as well, just to really keep an eye on how things are going in terms of your cycle. And you want to advocate for testing. So you want to ask for a full thyroid panel, cycle day 3 hormone labs, autoimmune markers, and sometimes you even have to request advanced sperm testing for your partner as well. We want to look beyond shallow diagnoses and quick fixes. So don't settle for everything looks normal, because if symptoms are there, they're there for a reason, and having a lab drawn on one single day, which just is a picture in time, does not overrule the symptoms that you're experiencing. And we want to address your fertility foundation. So, nutrition, sleep, stress regulation, reducing toxins. These are all going to play a very large role in restoring balance within the body. You can go through all of my podcast episodes and find so many different topics in regards to these fertility foundations where I'm sure there's room for improvement. So to recap, infertility symptoms you shouldn't ignore include irregular cycles, painful periods, spotting, recurrent miscarriage, hormonal imbalance signs, persistent fatigue, and ongoing digestive issues. These aren't random. It's not just in your head. It's not just a part of being a woman. They are signals that something deeper is going on, And when you take action to investigate and address them, you are going to move closer to the family of your dreams. So thank you so much for listening. I hope you have an amazing day, and stay tuned for Thursday's episode where we'll discuss a quick energetic and nervous system process to prevent you from going in a downward spiral when undesirable symptoms arise on your fertility journey. So I'll see you on the next episode, released every Tuesday and Thursday. Are you ready to finally discover why you haven't been able to get or stay pregnant? The Ultimate Fertility Blueprint is a quick, insightful quiz designed to reveal your overall capacity to conceive and help you discover potential root causes and areas to address to improve your fertility so you can finally get and stay pregnant. You'll find the link in the show notes. As a quick reminder and disclaimer, this podcast is for educational purposes only and is not a substitute for medical advice. Always consult your doctor or healthcare provider before starting any new supplement or protocol, especially if you're actively trying to conceive or undergoing treatment.